Good afternoon, I'm Sarah Birchall and this is my Inc. 5 Oscar. Using the A to E assessment, I was able to prioritise 3 interventions that I would use whilst taking care of Alison. I would like to note that during the time in my care, to help reduce her worries and concerns, I would be providing constant reassurance to Alison and possibly removing her parents from the room if she was comfortable with it, just to aid in reducing her anxiety. Prior to completing interventions, I would escalate care to RMO as she has a PUSE of 4. My first intervention is a focused respiratory assessment. Due to Alison being diaphoretic, increased respiratory rate and heart rate. I would inspect chest symmetry, use of accessory muscles, Alison's ability to cough, and checking for any signs of subcutaneous emphysema. Noting Alison is only 8 and she would be using her abdominal muscle, stomach and diaphragm to help inspiration because of the small space. I would palpate to confirm symmetry, chest expansion, chest wall, any tenderness, lumps, masses or unusual movement. Percuss to see if I could hear any fluids, air or solids. It could indicate hyperresonance, and auscultate for equal air entry. Whilst localizing may be difficult with Alison as her body is a lot smaller and her chest wall is thinner. Alison's asthma may be causing some abnormalities here, such as wheezing. During the assessment, if abnormalities for Alison occur, escalate care, go back and reassess airway, then breathing. Supplementary oxygen, repositioning, a chest x-ray may be required for Alison. My second intervention is managing Alison's pain, as her pain is 8 out of 10 and her heart rate is quite high. Using a pain assessment depending on the patient's cognitive ability. If Alison was able to understand questions, I would use the PQRST, so quality, region, severity and time. Or if she wasn't, a FLACC, so face, legs, activity, cry, consolability. With her gestures and bruising indicating the pain is coming from her right abdominal area, bloods may be taken to investigate if the pain is being caused by internal bleeding. If it was, there would be a decrease in hemoglobin levels in the blood. Anything below 135 would indicate this. IV bloods may be advocated for if internal bleeding was found to ensure cardiogenic shock doesn't occur. Analgesia would be provided to Alison to manage pain. I would assess Alison's tolerance and effect of the prior pain management. If fentanyl worked well, this would be given due to her increased pain and level and discomfort. 20 micrograms would be given. I wouldn't give the ondansetron at this time, although she is nauseated, because it doesn't match up with the handbook. I would contact the doctor to check this dose and possibly ask for a new order with a lower dose. If this dose was given to Alison, this could have some adverse reactions, such as a prolonged QT interval as seen on her ECG. My third intervention is investigating possible infections. With Alison's increased temperature, history of juvenile arthritis, and immune suppressants being given, the immune system is already under a lot of pressure. Therefore, the increased temperature may be a late sign of an infection. Precautions may be put in place to keep Alison and staff safe. A urine analysis or blood test may be given to investigate if there is an infection, and if so, possible antibiotics that could be helpful. If there was no signs of infection other than temperature, I would look into exposure. So treatment may include a cooling device just to help reduce that core temperature. Thank you.